Hey guys, just made it to SafeSight and today I'm here for my first consultation. I am high-key stressed because I really want this to be positive. I really want this to go well. I am by the elevators just because I want to go get my tripod stand so that I can actually, create more content and actually do something as well for my Instagram. I don't know whether I'm going to post this on here, YouTube, or post on Instagram. I mean, on Instagram you can only post so much, so I really do want to get like more in depth with you guys. And I'll probably, I hope, post a YouTube video. Way this way.
Hi. I'm good. How are you?
Good.
Okay, so my name is Lindo.
Lindo.
I do all the tests and scans in this room.
Okay.
And when I'm done, I'll take you over to go and consult with the doctor.
Great.
Okay.
Thanks, Lindo.
So how can I help you today?
Lindo, I wear glasses.
Okay.
And so it's but I always have my glasses on, so it actually works out perfect. But I can't see. I really would like LASIK surgery.
Okay.
Eye surgery.
Okay.
I just hope I qualify at this point.
Okay.
My bag.
How long have you had glasses for?
Since primary, so since grade 3.
Estimate for me about what? 19 years?
I'm 30. How old is
It's grade 3. How old are you in grade 3?
6,
You're 9.
7,
so
8.
about 20 years.
Yeah.
21. Yeah. Okay.
Motona 6 grade 1.
Yeah. So 7, 8.
8.
Okay.
Yeah, 8.
Okay. Do you wear contact lenses?
No.
No.
I
Okay.
wish.
Okay. Have you had any eye procedures done before?
None.
Okay. Are you on any chronic medication?
No.
Diabetes?
No.
Everything?
Thank the Lord. Guys, it's really bad.
Hopefully you qualify.
Yeah. So that's Lindo. She does all the procedures. And that is?
Koketo.
Koketo. Koketo ang DVD, guys.
Okay, so look at this side for me.
Okay.
Open your eyes nice and big. I'm going to take pressure. Okay.
Okay.
Okay, so
Is this going to be painful?
no. Okay. Big eyes for me.
I shouldn't have done put on makeup. I shouldn't have had lashes like.
But it's fine.
We're here now.
Slowly done. Okay. Can take a seat back. Thank you.
Great. So your career chose you.
In a bombshell.
That's crazy. Is it male dominated or is it female dominated?
I'm yet to meet a male ophthalmic assistant, so I'd say, I guess, female dominated.
Or maybe I've never asked, like, oh, what's your profession? Like, what's the name of your profession?
Okay.
That's interesting. So you still have to go like the doctor route?
No,
the eye
it's
surgery?
there's a course that you have to do. There's level 1 and level 2, and then once you've done the course, then you can assist doctor with the tests and scans in the rooms. Okay, thank you so much. You can take a seat back. Thank you.
Ooh, thank you. Is it this hard for everyone?
For most people, yes.
Jesus,
actually.
your eyes.
It's the no. As soon as I say no blinking, everyone wants to blink. Yeah. Okay, please have a seat for me on the big black chair. More tests. All right, and then doctor will be with you shortly.
Thank you.
Thank you.
It tastes so good. Everything's so hectically professional here. It's a bit intimidating. But I'm really nervous, to be honest, because I really want to qualify for this procedure. I've been wearing glasses for too long. It's enough.
Get rid of your glasses.
It's time.
It's time.
Since
21
grade 3.
years.
Yeah, it's a lot.
What do you mean 21 years? You only look 21.
I'm 30.
So
I'm not grown.
you've been wearing glasses all your life.
All my life.
Mm.
All my life.
Very say it's impossible.
And it's only getting worse.
Only getting worse.
It's really getting worse.
Alright, your scans look great. There's nothing that says I shouldn't be treating you there. So let me just look into your eyes. Then I'm going to do the prescription, is in the measurement of glasses.
Okay.
And then we can chat about laser afterwards. You can just put your chin there for me. Forward. Alright, you've done this a million times.
Yes.
This test. Let's see what your right eye can see without glasses. Read that out for me.
RDE.
So just tell me, between the vertical and horizontal lines, which ones are more black?
Vertical.
Vertical is more black. Okay, and then the
Okay. I can see an H in the middle.
Right, no, that's fine. This line is the 2020 line. Okay, that's what we refer to as 2020. Look, you do qualify for laser. There's nothing that says we can't treat you. You actually have nice corneas for eye laser. So you were saying earlier, you were asking what makes you qualify and not qualify. It's mainly two things, really. So we want you to have enough cornea. So the front part of your eye where you put your contact lenses on, it's called the cornea.
Okay.
The laser thins it out. So before and after, you're going to be a little bit thinner following the surgery, following the laser procedure. So if you start off and you're too thin, and we thin your cornea with laser, we might destabilize your eye. So we look out for people that have thin corneas, and those we want to exclude from doing laser, because if we treat them, then they're going to be unstable.
Right.
Yeah. So we look at corneal thickness, that's one big thing. And then the other thing is we look for diseases of the eye, but mainly of the cornea. So there's a condition called keratoconus that we particularly look out for. And the cornea is just inherently thin and weak. So we look for those patients.
Is it thin with age?
No, it's because their corneas are actually diseased.
Oh.
Sometimes you have normal cornea that is thin. It's normal, the cornea, but it's thin. But in this particular one, it's diseased. And then we need to match that with your script. That's why your prescription, that's why we measure that.
Okay.
So for example, you are around the minus 2.75 or minus 2.5.
Okay.
With laser treatment, we use about 16 micrometers of tissue for every 1 diopter. So you can imagine treating, you're not taking a similar amount of corneal tissue from somebody that's got a minus 2 compared to somebody that's got a minus 10.
Sure.
So it's not the same.
With both my eyes have an equal amount of cornea.
Yeah, both
Okay.
your eyes. Your cornea is nice and thick.
Okay.
562 micrometers. Normal corneal thickness, the average is about 520.
Oh wow.
Yeah, so you actually a perfect candidate for laser, because with the script of about 2.5, we're going to remove about 40 micrometers of tissue from your eye. Then you'll be left with 520. So following your treatment, only then do you come into the average, which is perfect. That's what we're looking for. No issues. Okay.
The panic is gone.
Yes. No,
Yeah.
congrats. The glasses can finally go.
Yo, amazing.
So,
Can
laser.
my eyesight get worse?
Your eyesight, yes, it can get worse. In your 20s, you have about a 20-30% chance of you needing a little bit of treatment by the time you turn 40. In your 30s, it's 1 in 10. It's about 10% of people might need a little bit of a touch-up in one eye or the other. And then after the age of 40, the percentage drops down to under 1%. So when you hit 40, you are unlikely to ever need a retreatment. But in your 30s, like you are, then we're looking at about a 10% chance. In your 20s, then we're looking at about a 20-30% chance. But the odds are you will never need to be retreated. Okay. The actual procedure itself, it takes about 10 to 15 minutes to do both eyes.
Oh, that's quick. So
You come in, you go home the same day. Yes, that's very quick. Yeah.
That's very quick.
Okay. And then we use local anesthetic. We put drops on your eyes. That's all we use. Your eyes will be completely numb. You won't feel a thing when we do the procedure.
Am I awake?
You are fully awake. Yeah. We can sometimes give you a tablet to calm you down, but I find that sometimes it's more of a hindrance than something that assists us. Some patients get a little bit too drowsy and you need to concentrate. There's lights that you need to look at.
Sure.
So some patients, because of the anxiety of having something done to their eyes, they don't sleep the night before, and then you give them this medication and all of a sudden they're sleeping under the laser when you want them to be looking at different lights there. So I don't really like giving it, even though you're a little bit anxious.
Yeah.
I don't really like giving that tablet.
I'm sweating very much because I'm like anxious.
No. Don't worry. I mean, we've done thousands and thousands of people without. Yeah, and everybody will be anxious. It's a natural response.
I'll brave it.
And then we put an eyelid speculum. I'll guide you on what to look at and what not to look at. And it's 15 minutes. It will be done for both eyes. Organize a driver on the day. Okay. We don't want you driving yourself away from this place. Yes, you'll be able to see. You'll have about 80% of your final vision when you go. And that's in week 1. Week 2, it's about 95%. Week 3, week 4, that's when you actually hit 100%. So week 1, we want you taking it easy. We don't want you going back to your formal work commitments in the first week. So you need to be,
booked off.
Be home. We'll book you off, and then the second week on, you can go back to work. The appointments are as follows. We normally do them on a Friday, the procedures, and we see you a week later, so next week Friday, and then we see you after 6 weeks, 4 months, and then 1 year. And you're going to use drops. In the first week, it's 3 little bottles, 1 for pain, 1 for to keep the bugs away. It's an antibiotic, and then the steroid to modulate and control the healing. And then week 2 on, you're going to use only the steroid drop for further 5 weeks, giving you 6 weeks of drops. Okay. You don't have to be indoors all the time. There's sunglasses. There's a pair that we give to you, but you can also use your own. There's something that looks like this. It looks like sunglasses that you have
That's
to.
on trend.
Eh?
At least that's on trend right now.
You think so?
It is.
All right.
Yeah.
So we've been on point for the last 17 years using this thing.
Yeah.
So the fashion world is finally caught up with us.
Yep. Finally.
We trendsetters. But yeah, so when you're outdoors especially, you're going to have to use sunglasses.
Okay.
And that you do that, I would say, for the first month or so. Just use sunglasses when you're outdoors.
Normal sunglasses.
You can use normal sunglasses, yes. You can.
But first week at least those are.
For the first week, these are good enough. Desk.
Okay, great.
But
Thank you.
you guys are going to be treated.
Thank you so much. I'll probably book for, we have a summit coming up, so that's in August, probably September. Get a bit of a break.
Come, let me
Hi guys.
let me take you to the other side. You need to see this side. Talking about
Oh, what's happening that side?
So this is our laser procedure room. At least it's in a decent
Okay, I feel safe.
state, you know.
No, it's
It's nice and clean. We were using it yesterday, so yeah. We're undergoing training, but we'll get there.
okay.
This is the aesthetic center, the beauty center. We're going to have there's a plastic surgeon, dermatologist.
Are you gonna
we'll
do
doing
BBLs?
all sorts of things, boobs.
Everything.
You know?
Oh wow.
Maybe let's give that office that we've been using it, but this is a consulting room. So we have 3 consulting rooms.
Okay.
And yeah, then maybe let's go through the back here. There's
When is the BBL room coming? Why am I calling it a BBL room?
soon. Is that what you're looking for?
No.
And then we have 3 therapy rooms.
Okay.
1, 2.
What kind of therapy is this? Like for?
So, Botox, fillers, there'll be laser screen treatments, and. So we're busy doing training, so these are some of our machines there. And there's training taking place.
Good.
And then we're still setting up though. There's going to be a cosmetic dentist
Oh wow.
to make those
Teeth whitening.
perfect smile veneers, just Hollywood veneers, making your
Amazing.
smile perfect. And then at the back here, this is going to be a drip area. Glutathione, antioxidants, immune boosters, drips, and yeah, and then we have counts. And we're back to the front desk there.
Incredible.
And then actually there at the back, this side, that's where, down there, but it looks messy. That's where the theatre is going to be, that door there. It opens to another section where the actual book jobs and stuff,
Yeah.
all the yeah.
This is huge.
Okay.
When are you going to open those procedures? Or estimation?
Are we on the right setting?
2 weeks.
In 2 weeks.
It's just, I mean, we essentially done. It's going to be stepwise. So we're going to do minor procedures first, and then the doctors have been going.
You have the doctors already.
Everything is in place, and we're just going to, as they learn and undergo training, we will introduce more and more procedures. But we have everything.
So people don't have to leave the country for these procedures. Because everyone's going to Turkey.
No.
Everyone's going to Turkey.
No. There's an 80%, Turkey won't be cheap anymore. There's an 80% inflation rate in Turkey. As we
For those
speak,
procedures.
for everything, generally.
Oh, wow.
So things are getting really expensive.
Okay.
Yeah, it's catching up with them. They have to bump up their prices. But anyway, so you will
So
sort out
much information to
everything.
share. Thank you so much. You've been a star. Tell her to bye to the people because you're the star. She is the star of the show, guys. Bye.